Hello. Hello.
Yes, 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 yes.
Swamiji, this is Dinesh Mittal, sir, from Ahmedabad, India. Sir, I am pre-diabetic. My H1B1 is 6.1. I am attached to some good system from American company. They are monitoring my glucose level continuously. So my glucose level is now fairly good enough. Now it is below 180, but it is going down to.
Yes.
Because we are monitoring continuously for 6 months. And my question is, can we cure it, sir? And what is the reason for variation in glucose level from 40 to 180?
Variation in glucose level. There can be many reasons for variation in glucose level. And one of the reason can be a liver issue. If you have any liver issue, your glucose level may fluctuate. The second reason may be any other organ discrepancy, like for kidney issues. When kidney issue starts, your glucose level can also start fluctuating. Also, you can have some autoimmune disorder or itis or inflammation in the body, like pancreatitis, like any other. Even if you have pituitary pathology or hypothalamic inflammation, there can be sugar level rise in the blood. It can happen due to panic. It can happen due to lack of mental strength, mental resilience. So if somebody gets into fear very easily, your glucose level can fluctuate, or this is called as adrenal fatigue. So adrenal fatigue or adrenal overactivity can also push your sugar level high or low. And there are many other factors. So sodium potassium exchange and so on and so forth. These are just terminologies. I'm just telling you, this is floating around on the internet and the fraternity, doctors fraternity, YouTubes and all the channels. So there can be many reasons for glucose level fluctuation, and there can be multiple reasons also. It is not just one reason which can be located for a can be a multiple reason for it. But is there any methodology to work on the entirety, or is there a methodology to find out the particular factor or reason why it is happening? This is what we are doing in our program. Through Prana Shakti diagnosis, we are trying to get to the root or the factor which started this discrepancy or this fluctuation. If you strengthen that and strengthen the overall system, you will get stabilized over a period of time. This is stabilizing is something which is needed at this point of time, and it has to be done. It has to be worked internally. You have to work on your internal factors to stabilize this thing. Numbers usually, let me tell you one more thing. Numbers doesn't say anything about your life. I have seen people with very high glucose level, and they don't have any symptom of that. I've seen people with what you call as very high white blood cells in their body, which is indicative of cancer, but the person doesn't have any problem. So these levels are an idea where which can suggest a problem, but it should be correlated with something called as your symptom. If there is a number found inside the body, you must correlate it with what your body is saying, because your body is the greatest diagnostic equipment. It will always suggest a difficulty or always indicate a difficulty within. If levels are fluctuating and there is no difficulty in the body, no symptom in the body, you don't have a problem. There can be only psychological problem in that time, because you're looking at a level and getting into fear. So if you have a level discrepancy and you have a symptom, if you correlate it with symptom, and then you can get to see what is the problem, and there is a problem, or if there is a problem in your body, then we can go towards finding out why this problem is happening, and then working upon it, creating a systematic balance within the body. This Ashtanga Chikitsa is all about creating that balance. It can be done here, but you are not diabetic. 6.1 is very low. Sometimes it might fluctuate due to chemical intake. When you take insulin or some other drug, you might also get into hypoglycemia, or can become hypoglycemic and can again shoot out. It is happening due to chemical intervention in the body. The fluctuating glucose level in the body can also be attributed to incessant chemical use, or you are using some kind of insulin or medicine. It can also be attributed to that.
I'm not using any allopathy, any insulin, nothing. I'm purely on naturopathy and Ayurveda.
Okay. Then there is a internal discrepancy which needs to be found out. And through our diagnosis, that is what we'll do. But ultimately, we see solution is working upon that factor, internal work or creating a balance inside. That is the solution. So yes, it can. First thing is it can be achieved. The second thing is, but you need to work upon your body.
Sir, we are seeing at least 14 to 16 parameters. Stress level, the intensity, the energy level, with all those, we are monitoring with artificial intelligence. It is a continuous monitoring. Still, these doctors cannot say anything. But glucose level is comfortable, situation is okay, no issue on that. Still, my question is why it is fluctuating that much?
So why, if you get onto a hilltop and watch things around, you can also watch. Can that be called as a diagnosis? You watch something happening, water falling, a bird flying. So your diagnosis monitoring doesn't mean anything. It is just a little enjoyment of senses, isn't it? You enjoy it in a different way, doctor enjoy it in a different way, and some people enjoy it in continuous internal monitoring of your body factors. It is just monitoring. It is just visual comfort or visual panic. You will get into either a panic because of what you have found, or it is just a time pass. So observation doesn't bring solution. Let me tell you that. And this is what everybody knows. Observation cannot be a solution. Even a child observes, this is red stone, this is blue stone. What does it say? It doesn't say anything. So observation, it doesn't mean anything, first of all. It can create panic, it can create difficulty because you are doing something, you are engaged into certain things, you are not engaged into living a life, rather you are engaged into observing certain things within the body. So it can create a psychological situation, can create a mental situation, but it cannot bring any solution. You can't get to solution for that. You can get experience by living life only. You can get experience by ideas. So what is the solution? That is what we are saying. What is the solution? Why it is happening? We will find it out in the diagnosis. At this point of time, what do we say? If we give you certain experiments to do with your body, and then you note down those numbers or those values and send it to us, send it to your picture, and what we'll do, we'll analyze the whole thing and get to a factor which is creating this discrepancy. Now, even if we do that, even if we say, oh, it is happening because of this, then what is the solution? There are so many diagnoses available. There are more than 750 diagnoses which can be done upon a human being. And you know, every body has 5 different cancer cells. Now, can you say the person has got into cancer? No, because the body takes care of the cancer cells. So the body has certain balancing mechanism, rejuvenation mechanism, which is there within the body, inbuilt in the body. That is why you come out of a disease. You don't come out of disease because of a medicine. There is no medicine for disease. Let me tell you, no medicine for diabetes, no medicine for thyroid, no medicine for heart disease, blood pressure, no medicine for cancer, nothing. No medicine cannot cure you. Let me tell you, your body only, medicine gives a little support. For example, even infection happens, it kills certain pathogen within, but the recovery happens because of your body, not because of the medicine. Chemotherapy is just cleaning out of your system, but cancer is happening because of cancerous environment. If you change the cancerous environment, cancer will come out of that. What I am saying is, we need to look in the right direction. We are missing the point. Medicine can be help, food can be help, exercise can be help. But what we have lost the internal strength and balance, and that is what I explained, 8 different factors in the body. So if you improve those factors, your body will help you come out of all your problems. And that is the only way. Let me tell you that. It is not boasting. It is not denying anything. No, you must speak what is what. Your medicine can only give you a little support in the time of difficulty, but it cannot cure you. Your food is raw material. Your body works upon your food. Calcium deficiency doesn't mean you are not supplying calcium. Calcium deficiency means that your body is not able to absorb calcium. It has lost the strength of absorption. So supplying calcium, nobody has come out of osteoporosis. That is not a solution. Solution is increasing the strength of absorption. So I'm just telling you, you also know that you people are very intelligent people. The thing is, you are educated. The problem is you are educated. So you are always trying to see things in the way you have been trained into. Just think out of the box. Just keep yourself open. Drop your education and see life the way it works. You'll see this is the solution.